Hello everyone, and welcome back to SKYE Physiotherapy. I'm Dr. Skye, your physical therapist. Today, we're diving into chronic neck pain with a patient case study. If you're struggling with the same issue, stay tuned to learn how we assess, treat, and ultimately help you recover. Let's begin. The gentleman in this video has been experiencing chronic discomfort in his right neck and shoulder area for several years. The pain is localized between the neck and shoulder blade and is not severe. There were no red flags suggesting neurological or vascular issues, but he did report a history of significant lower back injury. Initial posture assessment revealed that both of his feet were externally rotated and pronated. Clinically, bilateral pronation often accompanies anterior pelvic tilt and forward head posture, increasing the likelihood of neck or back pain. Therefore, when assessing or treating a patient with neck pain, especially without direct neck trauma, it's crucial to consider the alignment and function of the spine, pelvis, and legs. The squat test also showed limited movement, suggesting potential issues with the spine, hip, or ankle joints, or neurodynamic dysfunction in the nerve pathways from the lower back to the legs. Examination of the ribcage and head alignment revealed that the patient's head and chest were slightly rotated and laterally shifted to the left. This can stretch the nerves on the right side of the neck, causing muscle tension. Although there was no significant difference in the range of motion during head rotation, the patient reported discomfort on the right side at the end range, and the movement of the bones and joints at the manubrium and cervicothoracic junction was unnatural. This suggests that the root cause of the symptoms might be located below the neck rather than in the neck itself. The right shoulder blade was found to be downwardly rotated. Similar to the lateral shift of the neck, this can put tension on the neck nerves, causing overactivation of surrounding muscles and potentially leading to shoulder pain in the long run. The assessment of spinal movement revealed limitations and pain during forward bending and backward extension. The spinal erectors were particularly tense, and although not shown in the video, subsequent special tests, including slump test and straight leg raise test, were positive on the right side, suggesting neurodynamic dysfunction in the nerve pathway from the right spine to the leg. Although the neck's range of motion and joint condition were relatively good, the patient continued to report discomfort in the right neck and shoulder area. When lying down without a pillow, his chin was significantly elevated, indicating that his forward head posture does not easily correct itself even in a supine position. Examination of the skull area revealed overactivity in the muscles around the right head and jaw joints. As expected, the suboccipital muscles were tight, and the upper cervical spine was extended with limited movement. Overactivation of the right neck muscles was also confirmed. Patients with chronic neck pain often have issues with the alignment or movement of the shoulder blade on the same side. In cases like this patient, where the shoulder blade is downwardly rotated, it often leads to shoulder overuse, anterior shoulder instability, and overactivation of the muscles in the front of the shoulder. Although the shoulder range of motion was normal in this case, the shoulder can be easily pulled anteriorly as seen in the video, which is suggestive of the presence of glenohumeral ligament insufficiency. To prevent shoulder injuries and treat chronic neck pain effectively, shoulder rehabilitation must be considered as part of his care. In conclusion, this patient's chronic right neck and shoulder pain appears to be a secondary symptom stemming from previous back and lower back injuries, rather than a direct trauma to the neck. In such cases, it is essential to assess and restore the alignment and movement of the entire body, not just the head and neck, to effectively address the chronic issues. Therefore, the short-term goal is to restore head and neck alignment and relieve muscle tension. while the long-term goal is to address the alignment and function of the shoulder blade, lower back, pelvis, and feet. For our initial treatment session, after a thorough consultation with the patient, we decided to combine dry needling and manual therapy to address his immediate concerns and provide short-term pain relief. We began by targeting the muscles around the head and neck with dry needling, focusing on the temporalis, masseter, sternocleidomastoid, oblique capitis inferior, posterior cervical muscles, upper trapezius, middle trapezius, rhomboids, latissimus dorsi, and finally, the anterior deltoid. This approach aimed to reduce muscle tension and alleviate pain in these areas. Following the dry needling, we utilized the manual therapy techniques to release tension in the suboccipitals and improve the mobility of the upper cervical spine and the right cervical joints. We then performed joint mobilization techniques on the right shoulder joint and applied soft tissue mobilization and instrument-assisted soft tissue mobilization to the muscles around the neck and shoulders. These techniques help to further reduce muscle overactivity and promote better alignment. We reassessed the movement of the shoulder blade and reapplied joint mobilization techniques to the right neck joints with the patient in a seated position. Finally, with the patient standing, we implemented posture correction exercises to address the slight left rotation of the skull and the lateral shift of the neck. After the treatment session, the patient reported a significant reduction in neck and shoulder discomfort, as well as the pain he experienced when turning his head. However, given the findings from today's assessment regarding issues in the lower back, pelvis, and legs, we anticipate that these symptoms may recur if left unattended. Therefore, in the next session, we will conduct a more comprehensive evaluation of the entire body, including the back, pelvis, and legs, to identify the root cause of the problem and develop a more effective treatment plan. Thank you for joining me today at SKYE Physiotherapy. I hope you learned a lot about chronic neck pain and its potential causes and treatment options. If you found it helpful, please like and subscribe for more videos on how to move better and have a pain-free day. I'll see you in the next video, and thank you for watching.